This is a really timely question because Crisis Medicine just posted an article today where they talked about this. In this same article, they covered the March mnemonic, and the March mnemonic R has typically stood for respirations, and that was to place an emphasis on restoring adequate respirations through needle decompression or finger thoracostomy because of the prevalence of battlefield deaths during Vietnam from tension pneumothorax. However, some data has come out that suggested that prevalence wasn't as great as we thought, and maybe that R needs to be more like the resuscitation of things, placing an emphasis on lost volume. However, they want to place an emphasis on restoring that volume with whole blood, particularly in an ongoing hemorrhage, and so maybe the mnemonic needs to be changed to match for transfusion. This change is actually proposed by the trauma daddy himself, Dr. Andrew Fisher. Now, in this article, they say that if you had an unlimited supply of blood, that you may be able to maintain the patient with active hemorrhage. It's unlikely that you'd be able to do this for very long, but with isotonic crystalloids, you aren't doing anything good for this patient. In fact, outcomes are worse with the use of isotonic crystalloids. Now, if you have short-ish transports, you may get a little bit of a bang with your buck by administering small aliquots of fluid to attempt to target a map of 50, but you have to be very careful with this because this does a lot to increase central venous pressure, but doesn't necessarily do a lot to help the patient and doesn't do a lot to assist the body's attempt to control that hemorrhage. In fact, raising central venous pressure actually works against clots. But what you don't want to be doing is rapidly infusing liters of isotonic crystalloids in these patients because you're going to place them squarely in the center of the lethal trauma triad or the trauma diamond or the resuscitation rhombus or the transfusion trapezoid or whatever shape is going to be their coffin when you administer these large volumes of isotonic crystalloids. Blood has oxygen carrying capacity and clotting factors normal saline does not. I'll place a link to Crisis Medicine's article on this in my bio. It's a really great read, and I also recommend following them.